Good evening, friends, and welcome to the first session of Crossing Boundaries. It is a small initiative from Dr. Vidyaa Smile Dental Clinic that we want to reach out to our patients, especially during the pandemic, because I know you have a lot of unanswered questions in your mind. And this is an initiative which we've started from the month of June 2021. And it's our endeavor so that we can reach you and probably answer your questions for you. And with those few words, we are going to go ahead with today's topic. I'm sure all of you must be waiting for the answers through these questions, right? So I'm going to start sharing my screen share, and then we will go ahead with the topic. So I welcome all of you on behalf of Smile Dental Clinic to the first Crossing Boundary session. So our topic for today is importance of oral hygiene maintenance during the pandemic. And there is a disclaimer. I'm here to eliminate your fear, give you some facts, give you scientific-based evidence, basic and advanced safety protocols, and the latest information related to how you need to take care of your health, especially during the pandemic. So the eyes do not see what the mind does not know. And all of us have been hearing a lot of information related to the pandemic. And we have also heard about a rare fungal infection called mucormycosis, which is seen in few of the COVID patients, especially in the second wave. So what is mucormycosis? It is commonly known as the black fungus and has observed in a number of COVID-19 patients recently. A fungal infection mainly affecting the people with medical health problems that reduce their ability to fight the environmental pathogens. So let's look at where all it is and how it is. So there are, you can see in this diagram, you can see the mucormycosis on the upper jaw, closer to the eye. So there are 5 different types. One is the rhinocerebral mucormycosis. Rhino is the nose, cerebral is the brain, so from the nose to the brain. Pulmonary is for the lungs, cutaneous is on the skin, gastrointestinal is on your food pipe, and disseminated mucormycosis means everywhere. So mucormycosis, which is a rare fungal infection, basically takes care in the upper nasal cavity. And then it gives rise to a kind of a foul, bad smell coming from your nose. You have respiratory issues, you have frequent cold, feeling of a blocked nose, swelling in and around the nose, sinuses, and blackening or thickening or darkening of these parts of the nose and the upper cheeks. It can also cause fever and headache. And those above the age of 40 years are the ones who are getting affected, especially if they are immunocompromised. What do we mean by immunocompromised? It means people who already have some comorbidities like diabetes, hypertension, and of course, upper respiratory tract infection. So it's very important for us to approach an ENT surgeon and get their expert opinions before we go ahead with any diagnosis. Now, since the cost of the infection in terms of the treatment modality, your injection could cost anywhere around 2,000 to 3,000 rupees. So, and it requires at least 6 times a day for about 21 days. The cost is a real concern. So what is it? As we told, it's an aggressive and invasive. What do we mean by aggressive? Aggressive means it spreads faster, and invasive, it spreads deeper. So faster and deeper, and it is not contagious, but can be fatal if not detected early. So what is the deadly disease? Mucormycosis, as I told you, it is going to affect all the immunocompromised patients, especially if they are uncontrolled, and this could lead to also a death. And I already talked to you about the symptoms. In addition to the symptoms on the nose, you can see in the eye, you can have some kind of a blurring of the vision, or you could have even double vision. This black fungus is actually the new challenge, and that is how many states have declared the black fungus as a notifiable disease under the Epidemic Diseases Act in 1897, following advice by the center. And as I told you, the cost of the treatment is actually high, and that is why we are more concerned. And so obviously we all know prevention is better than cure, right? And this life-threatening fungal infection, if you can look at it, it also manifests on the lungs and in the brain. As I told you, the spread is from here to here. What are the symptoms of the black fungus to watch out for? I spoke to you about the crust, black crust. Other than that, it is the headache. I told you about the eye, nostril blockage, eye pain, and facial numbness or tingling sensation, which makes it difficult to chew and open your mouth. So 50% of the black fungus is so deadly that it is giving you a death rate at around a scary 50%, which means anybody and everybody who gets contacted with this mucormycosis, at least half of them are going through tissue death. And diabetes people, we know the healing is quite poor. So they are more vulnerable to the infection, and it strikes the COVID patients around 12 to 18 days after recovery. And that could also be due to overusage of the steroids, especially because they want to curtail the problem itself. And by steam inhalation, which could be the likely factors. So there are 9,000 number of mucormycosis cases in India so far, and 80 times the prevalence in India in 2019-2020 as compared with the West. And that is why it is of concern to us as a dentist. Likely causes, as I told you, we have spoken earlier, but however, high prevalence of diabetes, especially poorly controlled diabetes, is also one. And then we use these kind of immunomodulators like with steroids, and that is also causing it. And then you have a lot of variants of the virus itself. Along with that, the industrial versus medical oxygen for home use, and overwhelmed hospital with lack of hygiene, with masks, vent, oxygen systems, humidifiers are the others. This is a study by Dr. Madhurkar Pai. Now, all you need to know about black fungus is it infects the COVID-19 patients as well as the recurred patients. And this is a type of fungi which is seen in the environment, and the fungus surrounds the blood vessels and destroys them. We already told about who is at risk. However, we also need to understand the symptoms associated with black fungus. Next is the yellow fungus. So unlike the black or the white fungus, the yellow fungus starts internally, causes a pus leakage, and in some cases it can lead to organ failure and acute necrosis. It leads to slow healing of wounds. The potential causes could be prolonged usage of steroids, as I told you, contaminated environment, uncontrolled diabetes, unhygienic or dirty surroundings, lesser immunity, unhygienic habits, or comorbidities. And the symptoms include lethargy, which is tiredness, poor appetite, weight loss, and poor metabolism, and sunken eyes. Next is the white fungus. So we spoke about the black, we spoke about the yellow. The white fungus is similar to the COVID-19 symptoms. It has cough and breathlessness and chest pain, and headaches and swelling in some patients. So the black, white, and yellow fungus altogether has caused a lot of panic amongst the general public. Now, as we understand, most of the people who are getting affected for the black fungus are diabetic patients, white fungus are patients with low immunity, and yellow fungus are people with comorbidities. So what are the do's and don'ts? So the do's are to control the hyperglycemia, monitor the blood glucose level post-COVID, use steroid judiciously, use clean, sterile water for humidifiers during oxygen therapy, use antibiotics and antifungal judiciously. What are the don'ts? Don't miss the warning signs and symptoms. Don't consider all cases of blocked nose, as cases of bacterial sinusitis could also be there, and also cases of immunosuppressants and or COVID patients on immunomodulators. Don't hesitate in seeking aggressive investigations as appropriate for detecting fungal etiology. Don't lose crucial time to initiate the treatment for mucormycosis. Next, we need to understand the oral thrush. Now, oral thrush or candidiasis, you can see that it can affect your mouth, your skin, your nails, your vagina, your penile candidiasis, or any other organs of your body. Watch out for any of these symptoms before it turns fatal. We have spoken about that, but we are reiterating it. pain, redness around the eyes and nose, fever, headache, coughing, shortness of breath, bloody vomits, and altered mental status. So what are the steps to prevent this? Keep your blood sugar at check, use steroids judiciously, use clean water in humidifier, maintain overall cleanliness around patients, and any oral ulcer which can be treated immediately. So oral care during pandemic has become the need of the hour. And this I'm telling you because a lot of articles have been published on the same domain. Follow-up studies in COVID-19 recovered patients. Is it mandatory? Oral manifestations associated with COVID-19, oral manifestation and dental practice recommendation during COVID-19, oral mucus lesions in COVID-19 patients, new signs or secondary manifestations, oral manifestations of COVID-19 disease, a review article, oral manifestations of COVID-2019 related to multi-system inflammatory syndrome in children, a review of 47 patients, oral manifestations associated with COVID-19 again, and oral health in COVID-19, increasing the need for prevention and access. So now you understood a lot of studies have been put forth. And what I'm going to share is just going to be a kind of understanding of all this. Old strain, we see the three most common symptoms are the fever, persistent cough, loss of smell and taste. However, the new strains have aches and pains, conjunctivitis, sore throat, diarrhea, discoloration of fingers and toes, headache, and a rash on the skin. And as we need to understand the COVID-19, a seasonal flu, common cold, and seasonal allergies. So we need to differentiate between all the four. So how can we do that? If you have a fever, then if it is a yes, are you experiencing any shortness of breath? If it is a yes again, that's corona. If it's no shortness of breath, then it could be other symptoms like just the flu. Now you don't have the fever, but then you are having some itchy eyes, then it could just be some allergy. And you're not having fever, not having itchy eyes, then it could just be a common cold. We need to understand all these symptoms so that we can differentiate between the four and take actions properly. And this is very important as stuffy nose occurs only in 5% of the cases and diarrhea occurs only in 4% of the cases. These symptoms are just not common when compared to the other symptoms which we just discussed right now. So reiterating, all the common symptoms of COVID-19 could be cough, fever, shortness of breath, sore throat, headache, running nose, tiredness, muscle pain, diarrhea, loss of smell, and loss of taste. So you can actually divide this into three. One is the less common symptoms, most common symptoms, and serious symptoms. The serious symptoms includes the shortness of breath, loss of speech or mobility, and chest pain. Most common symptoms could be fever, cough, tiredness, and loss of taste or smell. Less common symptoms could be sore throat, headache, rash on skin, aches, pains, diarrhea, red or irritated eyes. So this is how the percentage of these symptoms are seen in patients. And we have in the oral cavity 10 different ways of it getting spread. So you can have to check the saliva, the gingiva, the ducts, the palatine tonsil, the ventral surface of the tongue, the hard palate, the soft palate, buccal, dorsal tongue, and salivary gland. So you need to check all these 10 areas in the oral cavity when you have a suspect of a patient having COVID-19. The oral symptoms, however, include the loss of taste or smell, dry mouth, excessive saliva, rashes in the mouth, oral ulcers, angular cheilitis, or bad breath. New COVID symptoms, you shouldn't ignore. Watch out for these oral symptoms. And I'm just going to show you an array of pictures so that you can understand. You can see this white slug on the lower area. You can see some white spots on the inner cheeks. You can see such ulcers on the palate or on the top of your mouth. Then you can see some red ulcers on the back of your teeth. You can see some whitish area on the tongue. You can see all over your body some skin rashes, fewer but many multiple ulcers, or any kind of a peeled skin, or some ulcers on your tongue, some ulcers on your palate, and on your lips. Now we have to understand that the fever blisters are contagious, which are seen in the outer aspect of the oral cavity. whereas canker oris or canker sores, which occur inside the mouth, are not contagious. So let's start uncoding the myths and understanding few facts. As we understand that patients might need dental treatment, the first thing is for you to contact your dentist. You can have a tele-screening or an initial patient evaluation over the phone itself. Then you can talk about your signs and symptoms and let your doctor know what are the basic precautions they need to take. You also can talk about your travel history, your epidemiological link, and whether we need to perform any dental treatment or not. If you are a suspected COVID-19 patient, then we need to take some protocols to work on you. You need to have a chest X-ray and COVID-19 screening before you report to the practice. Report to any local or state healthcare agency also. The things which are elective, which means which can be postponed for about 2 weeks, that's what we want to do. And we can have a close follow-up with such patients, especially over the telephone or on a video conferencing if you want us to see the lesion. In an urgent way, where you have acute pain or swelling, you can have pharmacological management with antibiotics or analgesics for painkillers, and again, close follow-up of the case using the telephone or a video conferencing. But in cases of emergency, we need to perform the dental treatment in a negative pressure room or an airborne infection isolation rooms. So what is all this about? Imagine an infected patient has some droplets, and that can contaminate surfaces in the dental office. And as a dentist, we also create some droplets and aerosols, and that could get into the air. And because it is airborne, you have suspected individuals who could also get affected and spread it again. So the direct contact or the indirect contact is going to be with the dental professionals or the dental ancillary staff within the practice. What are the areas? As I told you, we are looking at the buccal mucosa, the salivary glands, the gingival epithelium, and the tongue when we see a suspect of COVID-19 patients. So how is this going to be influencing in your treatment plan? We just are letting you know that it could lead to any probably, the kind of droplets which comes out. It infects the air around, and it could have a long distance or a close contact spread. So in these times of COVID-19 and with the tobacco use, it is just that you're increasing your risk of getting the coronavirus. And it is better to give up this habit, at least at this point of time, before it starts affecting your lungs. As you all know, smoking itself could impair your lung function, and it would become difficult or, kind of hamper your body to fight off this respiratory problems. So if you're thinking of quitting tobacco or any forms of smoking, this is the right time to do so. As we know, prevention is better than cure. But I'm going to tell you, prevention is economical, effective, safer, wiser, and smarter than cure. After vaccination, you can continue with the COVID-19 preventive measures. I'm sure most of you must have started getting your vaccinations done. You have a first dose and a second dose. Cover your nose and mask with a mask. And this is very important because when you cover it with your mask, you see that you seal your nose, seal the sides of your cheeks, and go up to the chin so that the entire nose and your mouth is sealed. Stay at least 6 feet away from people who don't live with you. That means they're strangers for you. Avoid crowds or any poorly ventilated spaces. Wash your hands as many times as possible and clean and disinfect frequently touched surfaces. Most importantly, don't have a fear psychosis, because the more you fear, the more you will attract that. So coronavirus, second wave, and what are the new symptoms? As we had already told you, the 5 basic oral manifestations are the Acoustia, anosmia, hyposalivation, oral ulcers, and gingivitis. Let's start with the basics, with the toothache for starting. Normal causes could be negligent or improper dental care. Severe flossing is necessary. Something can be stuck between your teeth and biting into any hard food substances. Other causes could be impacted tooth, which means tooth which are buried inside the bone. You have decayed teeth, cracked tooth syndrome, recession of the gingival tissue, periodontal abscess or abscess, bruxism, sinus infection, or dry socket. Dry socket happens after you extract, and if there is a less blood formation, and hence you will have an open wound. COVID-19 in children is also of concern. Common symptoms are diarrhea, vomiting, pain in the abdomen, and the others are fever, breathing difficulty, fatigue, mild cough, loss of appetite, and new loss of taste or smell. We need to understand that these children are more prone, and hence protect them, take care of them, avoid taking them outside, and try to follow as much as the COVID protocol as possible. Keeping kids' teeth healthy during the pandemic is very important, and you need to brush properly, and you need to floss between the teeth. You need to use a fluoride rinse so that it could help you, and try to lessen your sugary beverages and any kind of fatty food substances. What is Acoustia and anosmia? The loss of taste and smell is sometimes the only symptom which COVID-19 could have. These are generally temporary, and the taste and the smell significantly improve and return within 4 weeks. However, in some cases, they may take up to 6 months. So, the different types of Acoustia. Acoustia is complete loss of taste. However, dysgeusia means distorted taste. Hypogeusia is reduced ability to taste. And phantogeusia is a gustatory hallucination which occurs without a stimulus. For the smell, it is anosmia, which means complete loss. Hyposmia, which means reduced ability to smell. Parosmia means distorted odor perception, and phantosmia, which olfactory hallucination occurs without a stimulus. How can I make it well? You can have some red chilies, castor oil, and different types of aromatic oil to help you with that. Sources of COVID-19 in saliva is also seen in the upper respiratory tract and the lower respiratory tract. COVID, especially in the blood, having access to the mouth via the crevicular fluid, that is the area between the gums and the teeth, and COVID-19 infected major and minor salivary glands. And how do we improve salivation? You can have ginger, you can have apple, hard cheese, crunchy green leafy vegetables, bitter greens, and citrus. And of course, don't forget to take a lot of water. Periodontal disease, the signs and the symptoms are also of concern. You could either have red, swollen, painful gums, loose teeth, shift of the teeth, receding gums, or frequent bad breath. So this is a link between periodontitis and other inflammatory conditions. The body fights the bacteria, and then the immune system gets vulnerable. The tissues and organs are damaged, and again susceptibility to other secondary infections. So we need to be careful about periodontitis. What is periodontitis? It means the inflammation of the periodontium, which includes the gums, the bones, the periodontal ligament, which connects the tooth to the bony socket. So in terms of diabetes, obesity, or cardiovascular system, we need to understand that the oxidative stress is of concern. And this cytokine storm or inflammation could lead to morbidity or mortality. So what you can do if you're at a higher risk of severe illness is, are you at a higher risk of severe illness because of your comorbidities? You need to understand that, and you need to take proper care for you. Here's how you can help yourself protect. Limit contact with any other person, wash your hands, avoid close contact, clean and disinfect, and avoid all cruise travel, which means try to avoid travel as much as possible. Coronavirus and the comorbidities. So let's take the heart for first. So we understand that you're going to have cough, fever, dyspnea, tachypnea, hypoxemia, pneumonia, and ARDS. And along with the heart and the lungs, which is the problem, you will see that it could lead to multiple organ failure or death. In terms of the heart, you have myocarditis, thrombosis, and arrhythmias. Thrombosis means a blood clot actually blocks the area, and thereby there is no blood flow. So we need to prevent, and we need to control our glycemic control, which means your blood sugar. So in very stable patients, it's fine. You can stay at home and control. If you're moderately ill, it's better to be hospitalized so that you have better monitoring system. And if you're hospitalized for a severely case of diabetes mellitus, they might put you on IV insulin, electrolyte management, and of course, monitor your fluid status. Hand hygiene has to be followed. See that you don't keep touching your hand in others areas, and avoid touching your face too. And of course, the risk factor continues to be the comorbidities. Many of them have got pregnant during the COVID. So how can I protect myself against COVID-19? If this is your concern, wash your hands frequently, avoid touching men, as we say, mouth, eyes, and nose. Space yourself from others and cough or sneeze only with your bent elbow, like this. If you have fever, cough, or difficulty in breathing, seek care early beforehand and follow medical advice. And these are the pregnancy considerations, especially when you are thinking about coronavirus. And don't skip any of the prenatal care appointments with your gynecologist, and see that you're very mindful about protecting your baby and yourself during the entire process of your pregnancy. Sometimes if a pregnant woman finds it difficult to wear a mask, see that the others in the house are at least wearing the mask. Next is mouth ulcers. What are the causes? It could be acidity, especially when they are sensitive to lime, pineapple, or strawberry. Any viral or fungal infection. Dental braces could cause ulcers. Mouthwash, which is which can be a little irritating to that patient, maybe with a very sensitive intraoral skin. When you brush and you accidentally either hit your tongue or your lip or your other areas of your gums, that could be a reason. And lack of vitamin B12 and iron, that could also be a reason of mouth ulcers. So your tongue actually reveals a lot about your health. If you have a fissured tongue, that means you could also have psoriasis or skin disorders. You have white creamy layer patches, that means they are the oral candidiasis, as I explained before. If you have abnormal smoothness, that means you're called atrophic glossitis. That could be very burning in nature. If there's a bright red, that means it's a symptom of vitamin B12 deficiency. If there is a thick yellow coating, it could be due to excessive bacterial activity. If you have a black or a hairy tongue, it could be because of smoking or any other poor oral hygiene. Some painless bumps, then you need to understand it could be also cancer. And if you have sores on your tongue, you need to see if there was some accidental biting of your tongue, or there is stress or any hormonal imbalance. So pink health is a healthy tongue color, yellow coating is digestive systems disorders, and thick white coating could also mean intoxication or infectious disease. In the wave 1, we spoke about physical health crisis. In wave 2, we talked about economic crisis. In wave 3, it also mounts the mental health crisis. So I'm going to show you or help you understand how best we can be to the best of our, or the pink of our health. So whatever wave 1 did of having immediate mortality and morbidity of COVID-19, I'm sure the graph is coming down. But if you can see wave 4, which is talking about psychic trauma, mental illness, economical injury, or burnout, has started as close to wave 1, and it is expected to only rise around the wave 2 and the wave 3. Mental health symptoms during COVID-19 has been like people have felt they are emotionally exhausted, they've increased sadness in a day-to-day life, more irritable, feel generally more confused, increased insomnia, which is sleeplessness in the night, increased anger, increased feelings of guilt. Younger adults are more likely to report symptoms of anxiety and or depressive disorder. And if you look at the age groups, it's the younger age group which are affected, obviously understanding that after giving their exams, how do they do about their career or the jobs, or many have lost their jobs or working at half pace. The elder population have actually well retirement plans. So I guess, their effect is much lesser when compared to the younger generation, especially below 50 years of age. Now, access to mental health services during the COVID-19 has also been of concern. There is either delay because they're feeling stressed over it, or there is disruption, and they think that, they will have access to it later. And the psychosocial support also supports this kind of a delay. So let's understand some simple oral hygiene concerns which could reduce the COVID-19 severity. And we're just going to talk about that. So this is what the World Oral Health Day report said by the FTI, which is the Federation Dentaire International, to practice good oral hygiene routine, for which you need to brush your teeth twice daily. And each time you brush it for 2 minutes, you can sing happy birthday to you twice, and then replace your toothbrush, especially once in 3 months. And if you got affected with COVID, throw the old brush and use a new brush, and avoid sharing any kind of personal items, especially till the pandemic is over, and floss at least once or twice a day, and rinse your mouth after every meal. Now, caring for your oral health during COVID-19 also helps you understand to reduce your dental visits, which means you need to reduce all the acid attacks. So once you start eating food, see that you are not using any of those beverages which cause a reduction of your calcium levels on your teeth, thereby making your tooth more prone to cavities. Also, as we had told before, you need to start drinking lots of water, eat 3 times a day, which is the 3 meals, and add a lot of green leafy vegetables, and include proteins and fats in your diet, and choose healthy snacks like apples, crunchy nuts, vegetables, and plain yogurt, and also limit any kind of unhealthy snacks. And this is very understandable because most of us have started cooking at home and eating only home food because there is no access to any hotels or any such things, right? So disinfect your toothbrush regularly, postpone non-essential dental visits, don't share your food or drinks, and improve your oral hygiene and follow 2 into 2. As I told you, twice daily brushing with 2 minutes per brushing. So let's take a pledge today that we would follow this 2 into 2.
To keep your mouth healthy, it's so important to brush your teeth for 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a 45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides, including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal and replace your brush every 3 to 4 months, sooner if the bristles get frayed. Brush twice a day, floss once a day, and see your dentist regularly. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
So I'm sure this video helped you understand how to brush your teeth. Now let's understand how to floss.
In addition to brushing twice a day, flossing once a day will help keep your mouth healthy by cleaning between your teeth where a brush can't reach. It also helps prevent gum disease. Wrap about 18 inches of floss around a middle finger with the rest wound around the opposite middle finger. Hold a small amount of floss, about 1 inch, tightly between your thumb and forefingers, and gently insert the floss between the teeth. Hug the floss tight to the side of your tooth. Rub the floss gently up and down, pressing against each tooth. And remember, get behind those back teeth. There are other products to help clean between your teeth, especially if you have braces or have a hard time holding floss. Always ask your dentist if you have any questions. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
So I'm sure you all must be understanding that brushing and flossing becomes the main things that you need to follow from home for your oral care. 7 in 10 people refocused on their health and well-being during the pandemic, and they have started focusing more on their physical and the mental health. So take up some relaxation practice, deep breathing, meditation, yoga. Regular practice delivers the greatest benefits, and start moving your body. There's always a reason to smile. Find the reason. Stay positive in hard times. I'm sure hard times hit very badly, and it has caused a lot of anxiety, anger, and depression. However, shift to a bigger picture of your life. shift your focus of your problem, and then start counting your blessings and get positive. What can I learn from this? What are the hidden gifts? How can I get smarter and stronger because of this? Smile and laugh out loud. Take adequate rest and sleep well, because that gives you a kind of a mental balance, especially just like seeing this baby. So what are the 7 S's which you need to follow? 1, reduction of your sugar so that you can keep your sugar at check. Reduce your salt intake also so you can keep your BP at check. Reduce your stress levels. Practice meditation, yoga. Say no to smoking. That's very important. Sleep well. That's a very important S. Next, do exercises. Sweat it out. And last but not the least, smile more often. And then you're good to go. So follow these 7 S's, as it is going to be your mantra to fight through the pandemic. Thank you, dear friends, for attending this seminar. And I am Dr. Vidyaa Iyer, and my number is 98401-76088. For any queries, you can always contact us back. I would be ready to take your questions. Thank you.